Hello everyone. Let's see. This is going to be the draw along for the muscular system. And just a quick overview. Muscular system, the purpose, it supports the body. The muscles allow you to move bones. It helps to maintain body temperature. Muscles assist with circulation. To some extent, they protect bones and underlying organs. And they help to stabilize joints. So just a quick overview of the muscular system. Well, let me see here if we can move that. Okay. Just a quick look at the at a muscle. So if we have get that out there. If we have over here sort of a cross section of bone, say this is it could be any bone. And here's the spongy bone inside, which you'll remember from the skeletal system. That muscles, let's have one come off this way. Yeah, I get a little too dependent on this smoothing tool. I really like it, and my hands shake like crazy because I drink way too much tea. So there we go. So if we were going to connect a muscle to a bone, which is the way it works, we have this fibrous bit that leads up to the body or the belly of the muscle, and this bit is called a tendon. And tendons connect muscle to bone. You also have something which we'll probably talk about when we get into the knee surgery piece. Ligaments. Different than tendons, but people confuse them. Ligaments attach bone to bone. Alright, so we're working with tendons right here on the muscle at this point. If we do kind of a cross section of, that's not very good. If we do kind of a cross section of this muscle, we'll see that we're working with a few different things. First, we're going to put on the outside of this, we're going to put a layer of fascia. And the fascia it's a thin sheath of tissue that surrounds a muscle. You may have heard the term myofascial release, where it's like a massage technique. But so you're going to have this sheath, this would go up over the entire muscle, so we could just keep it going right up here. You know what we should do is put that on another layer. That'd be kind of fun. Put on another layer. And if we draw it around here, this will be our layer of fascia. Then I can erase stuff without causing myself too many headaches. Eraser soft, zero hardness. We'll just have that kind of taper off. There we go. And we can also turn it down. So there's going to be our fascial sheath around it. And my inker brush back. Alright, I realize at this point that I'm going a little too much on this, but it's hard to stop yourself sometimes. Okay, so we have this blue sheath called the fascia. F-A-S-C-I-A. I'll get that out of there for now. We also have another layer that's right on the surface of the muscle. It is the surface of the muscle. And this layer is called the epimysium. E-P-I-M-Y-S-I-U-M. Epimysium. And there's our fascial layer on top of the epimysium. Within the epimysium, we're going to have these basically little pockets. And these little things are called fascicles. And within each fascicle, and they packed in here plenty tight, you're going to have the muscle fibers. The part that actually contracts as a whole or relaxes to let you move your muscles. And then between, I'm just going to make them blue. Oh, we do both. We're going to have, coming up in the middle, we're going to have blood vessels in here. So if you see where it aids circulation, as you contract your muscles, you are helping to pump blood through your body. And the vein and the artery are usually going to travel together. So probably the biggest takeaway from this, I would think, at this point right now, is the idea that the tendon is going to connect the muscle to the bone. Let's see. And we talked about in like standard color schemes, we talked about that these tendons and ligaments are often going to be like a, you could probably go with like a light blue, a white, that's definitely not it. See if I get a really light blue. Really light blue, maybe a kind of creamy white, and sometimes if I can find it, I'll put a little light purple in here just to give it a little more interest. And it's just going to kind of blend right into the bone there. So, quick overview of muscles. Okay, so we are going to let's take this and we'll stick it in a folder and we'll tuck it away for later in case we want it back. And I got that in the way. That's ridiculous. Okay. What we have here, this is the skeletal system drawing that we did in class last week, and we're going to just start today with the muscles of the head, the neck, and the torso. So if we pull up our little skeleton, our skull that we drew last week, and we're going to add some muscles to this. Okay. We're going to start with, let me see, where am I going to start? We're going to start with this, the big muscle right here on your head called the frontalis. And the frontalis is kind of right above your brow ridge. And if you kind of try to move the skin on your head, you're using the frontalis. And this muscle has a tendon across the top of your head. So there's no actual muscle right there. But when we get to the back, it picks up again with the occipitalis. Remember, that's the occipital bone, the occipital lobe, so the occipitalis. So here's our muscle. And our tendon. Okay, you get the idea. Let's see, this is the frontalis. And the, let's make sure I spell this right, occipitalis. Let's see, Occipitalis. The occipitalis. Right. The next muscle that we're going to look at is a larger muscle, and it sits right here over the temporal area. Oops, I wanted to do that kind of all in one. Big swatch. And this muscle, it's actually going to sit, we'll erase a little bit here. Oops, we'll try to erase a little bit here. It's actually going to sit back here behind the zygomaticus, and it's going to attach to the coinoid process of the mandible. And this is a muscle that's going to be used in what's called mastication or chewing. So you see this rather large muscle. And then down here we'd be getting into the tendon, of course. You get the idea. This is the temporalis. I'm trying to label this where it won't be in our way or later. Okay, next muscle we're going to put in here, pardon me, it's a muscle that goes all the way around the eye. And this muscle is named both for its shape and for its location. This is the orbicularis oculi, because it goes around the eye. It's round and it goes around the eye, so the orbicularis oculi. And most of these muscles that we're drawing are kind of muscles that affect the surface anatomy of the body. So these are muscles that are going to help you in your figure drawing in general, not just in your study of anatomy. Then we have another orbicularis muscle that will form the lips, and again, oops, that's a little big, and again named, well, I know I'll draw this eventually. Named for both its shape and its location. And this is the orbicularis oris. And the next muscle that we're going to put in here, I'm actually going to go backwards just a second, and come on, I want to get some of this temporalis muscle out of here, because I just realized that I made this just way too low on our drawing that we did the other day. That this coinoid process should come up really a whole lot higher. Let's see if I get a darker blue to kind of match that. So this, not that. Alright. And then if we go back and we can put the temporalis muscle attaching right back in there. Alright, and the reason I realized that mistake is because the next muscle we're going to draw is called the buccinator. And this is a muscle that makes up part of your cheek. It attaches to the orbicularis oris, and again it attaches to the jaw, which is why I realized my little screw up. And this one is the buccinator. And we're going to cover that. We're going to come back right in and cover that up. I just got my list. I'm clicking through to make sure I don't miss any. I'm going to come right in. Actually, we'll go light. Opacity, turn that down. With the masseter muscle, which is a large muscle that again attaches up here to the zygomaticus and attaches to the jaw. And it covers the part of the temporalis, and it covers the buccinator. And again, this is going to be a cheek muscle. If you clench your jaw really tight and feel right here, that muscle that you can feel tightening, that's the masseter. And that's M-A-S-S-E-T-E-R. That's the masseter muscle. Again, it attaches to the zygomaticus. Right backwards. The next muscle we're going to put in, actually, though, is the zygomaticus muscle. And the zygomaticus, you have a major and a minor, and both of them connect here to the orbicularis oris. So you see these kind of overlapping muscles in the face to give you, these are known as, what we're studying is known as the muscles of facial expression. And I don't care that you know which one's the major and which one's the minor. Just that you know that these are the zygomaticus muscles. All right. Then we come on to, if I want to put it on here or on, I'm going to put it both places. We come one of my favorite muscles. And it's got this great long name that took me forever to learn how to spell. Once you realize what it is, it's called the sternocleidomastoid. And it is S-T-E-R-N-O-C-L-E-I, mastoid muscle. And it's called the sternocleidomastoid because of where it connects to the sternum, to the clavicle, and to the mastoid process, which is this lump that we drew right here. This is the mastoid process. And the sternocleidomastoid, it connects in two spots. It comes down and it connects up here to the sternum, and then it comes down and it connects to the clavicle. So from here, this is the sternocleidomastoid muscle, which is what that is, a sternocleidomastoid. We'll just call it the SCM for short. And that is one of the muscles that come down and attaches to the sternum, to the jugular notch. If we go back here to the first one, so this is the jugular notch here. The sternocleidomastoid comes around and from the mastoid process and connects like here, and it really gives definition to the neck, and you'll see this in all kind of drawings. And if you do comics, this is a muscle that's often really exaggerated to make superheroes look super bulky and strong. So that's the sternocleidomastoid. And do your best with the spelling. Don't lose your mind with the spelling right now. I'm more worried that you learn to recognize these and understand what they do as far as how they affect the surface anatomy for drawing, than that you have proper spelling of everything. So those are a lot of the muscles in the face that we're going to look at. Others are in the what we call muscles of the head and neck. And I just realized I need to get this out of here. We'll identify it right on the muscle itself. The next muscle that we're going to look at is a really big muscle called the trapezius. And if we go over to our skeleton to the back view, you'll find that it connects up here on the external occipital protuberance of the skull, and it comes down and connects to the scapula, to the shoulder blade in many places. Oops, let me get those out of there. Actually, I don't want it to go that direction. I will put that in a second. Should have turned my symmetry tool on, make it quicker. Comes across the spine, the top of the scapula, and connects down the back. And this is a trapezius muscle. And you might feel this getting sore if you're sitting and you're staring down at your cell phone for extended hours. That this holds a lot of weight up. It's when it holds your head up. And I feel like I pull this muscle all the time. And the fibers go multiple directions. A very cool muscle. This is the trapezius. From here, it's going to look, from the side view, it's going to look kind of like not much. There's your trapezius. And again, from here, the external occipital protuberance, it's going to connect right in here. So that's going to be your trapezius coming down. And then we have another big muscle. And let's see, I also realized I got to get a couple other labels out of here. This is the masseter. This is the buccinator. I'm going to BUCC. Buccinator. You have this really big muscle called the platysma, and it connects up here on your jaw, and it makes this big sheath that goes all the way across, and it comes down and connects to the clavicle. And if you can really flex your jaw, push your cheeks out laterally, if you can kind of flex the muscle that way, you'll find a big flat sheet kind of under your chin. That is the platysma. And again, you can see how these muscles, they're called the muscles of facial expression, with the exception of the trapezius. Probably not the sternocleidomastoid, but the platysma definitely, and then all these that we drew up here help make up the shape of the body. So again, if we draw the platysma in, and you'll find, again, I think we talked about this once before, that if you can draw the skeleton and you know where the muscles are, and you can draw the muscles, you pretty much can draw a figure. So if we put in, the cartilage for the nose, you can see the chin coming back here. You get the idea. You can very easily, just by adding to this kind of skeletal structure, you can create a figure pretty easily. You get the idea. Let's see if I had any others. Give me 1 second. I'll see if I had others I wanted to show you today. Oh, I did actually. I have, I think, 6 additional muscles in the torso that I wanted to show you, and I think for those right now we'll go back over here to the front, back, and side view of the skeleton that you had drawn in the previous class. We'll leave the SCM on there. I'm gonna add another layer just because I can. And the first muscle I wanted to talk about is the deltoid. And the deltoid is a large muscle that makes up your shoulder. And it connects partly to the clavicle, to the shoulder blade, and it comes over the head of the humerus and attaches down here on the arm, on the humerus. And it actually, you don't super need to know this. It actually is made up of 3, it's called bellies. So like 3 sections, these 2 and then 1 towards the back. But this is the deltoid muscle. And this muscle, the deltoid, is actually named after the shape. This shape here is called a deltoid. It's not really a diamond, it's kind of an offset diamond. So this is this deltoid. And that is kind of the shape of the muscle with the 3 separate bellies. So that's one way they name a muscle, is by its shape, or like the sternocleidomastoid by its attachment points. You'll see some are going to be named by their size, others by location. There's just a whole slew of possibilities. So that's our deltoid. The next one we're going to put in here is the pectoralis major muscle. And that is the big muscle in your in your chest. And it's going to connect to your sternum, I don't want it that high. And it's going to come down here and connect to the humerus. Get rid of that. And the fibers come from all these different directions. And this is the pectoralis. major. And you do have underneath it, you have a smaller muscle called the pectoralis minor. So again, that one is named kind of for its size. We have another muscle. I'm going to draw that one, this one from the back view. And it sits underneath the scapula, so underneath the shoulder blade, underneath the trapezius. It's called the serratus anterior. Serratus because it's kind of got this sawtooth approach, and anterior I can only imagine because it reaches around to the front, and it comes around maybe the side view might be better. Anyhow, it comes under there. It comes from the back. Let me just rough this in. This just doesn't look like much from the back. From the side view, it comes around and it connects to lots of different ribs. Kind of like this. From the front view, you've probably seen this on drawings or somebody that's really ripped, and you can see this kind of ripple of muscle right here. These kind of like sawtooth ribs. That's the serratus anterior wrapping around. So that's a hard one because it literally goes all the way around the figure. It's on the back, comes around the side, and connects to the front. So it's a tricky one. And then we have another muscle here on the side. Oh, where do I want to draw that? That kind of meshes in with the serratus anterior. I'm gonna draw it in blue to get started. Called the external obliques, and it connects here to the pelvis. And it connects up here in the ribs, and then it's got this really large tendinous area. Well, it's not even a tendon, it's just connective tissue area. And this part is going to be the muscle. Right up here under the pec. And the connective tissue between it. Kind of in here. And that's your serratus anterior. And again, you see, as you start to like close in the form with the muscles, you start to look a lot more like a human body. Did I name that one? This is the external, maybe I called it the serratus anterior, which is this one. I can't remember now. This is the external obliques, and I don't know if I said that. The external oblique. So we've got the external obliques here, and we're going to cover them up with another muscle. Try to find a different color maybe. And we have a big muscle called the latissimus dorsi, and it again connects to the humerus, slides in under the trapezius to connect to the back, and it has this almost wing-like appearance that it finishes on the back, where it connects down here to the hip. And this will be the connective tissue of it. This would actually, it connects to the bone, so this would actually be a tendon. And this is the muscle of it. And hopefully I told you it was latissimus dorsi, and I'll spell that in just 1 second. You can see how it goes over the serratus anterior. It would cover these ribs. And let's see, let's go up here. This is the latissimus, L-A-T-I-S-S-I-M-U-S, dorsi, D-O-R-S-I, latissimus dorsi. And those are the muscles that I wanted. Whoopsie! Those are the muscles that I wanted to cover right now. Some of the main torso muscles, and if we put the external obliques in here, and the muscles of facial expression, and we put the latissimus dorsi in here. You start to see how these muscles all kind of come together to make up the form, and you put the pec major in, deltoid. You get the idea. Muscle back here, the gluteus maximus, which means that coccyx is out a little too far, I think. Gluteus maximus and minimus. We'll get to the legs and stuff, things later. But it's just kind of interesting that, once you know the anatomy, drawing the figure just kind of becomes a whole lot easier of a proposition. And in the muscular system too, we'll do the limbs. So we'll do the arms and the legs, and kind of put this all together. So again, hope you had fun with that, and if you have any questions, don't hesitate to drop me an email.